This is Dr. Rajesh Kumble. From the time I started practice here in the United States, I've always wanted to give back something to our patients and our healthcare systems in India. Now, being here in the US, it was very difficult for me to try and communicate the entire the ideology and the vision and the mission to partners in India. And I was definitely very fortunate that I came across one of my friend's mothers, Mr. Shantakumari, who was extremely motivated to be able to help the patients in the Indian healthcare system there.
சாந்தா ஜெகநாதன். அமெரிக்காவில் ஹாஸ்பிட்டல் போனப்போ எனக்கு தோணுது என்னென்னா, அமெரிக்கன் மெடிக்கல் சப்போர்ட் சிஸ்டத்துக்கும் இந்தியாவில் இருக்கிற மெடிக்கல் சப்போர்ட் சிஸ்டத்துக்கும் வாஸ்ட் டிஃப்ரெண்ட் இஸ் தேர். அதனால் அதை இந்தியா லான்ச் பண்ணுங்கிற எண்ணம் எனக்கு அப்போ இருந்து உறுத்திட்டு இருந்தது.
Having experienced the wait times and the process difficulties in the healthcare systems in India with my own parents, I decided that there is technology that can definitely help this particular process. What we were looking for is a simple system that's intelligent enough to be able to help the providers document and record the patient details, as well as a system where the patients can interact with the doctors.
When we went out with this electronic health record to the doctors, initially we had a little bit of hesitations how they would accept it, since it is a new culture to them. We were, quite unsure how the patient would welcome it.
We used to use something called as electronic health records from eMedHub for the last 1.5 years. All the records were saved in that, and that really worked for us. At the time when we were not able to physically contact patients and ask them what they are doing, how is their mental and physical health, we were able to do teleconsultations, and that was possible only because of eMedHub.
So I think one of the key feature for this welcome or success is it was built by a doctor for the doctors.
I was looking for ways and means in which I can actually develop a software product that would help with the electronic medical record systems for the doctors, but also be patient-centric, where the patients are the ones controlling this particular application, controlling the information that they have in them, as well as ensuring that the patients are able to communicate very well with the doctors.
It is health records of the patient. So we had to concentrate more on the security and confidentiality of the patient's record.
We have implemented multiple layers of encryption to safeguard patients' sensitive medical data.
We built complex architecture to overcome multiple factors like reachability, scalability, and security.
eMedHub app is so user-friendly that it was just a matter of 15 to 20 minutes to understand the full app and use it. And it's so user-friendly that I see the patient and simultaneously I finish my doctor's notes in a matter of a minute or so. I think that is one point where this app stands out very different from the other apps which are available in the market. And I really like eMedHub app for doctors.
That was very important. And also to be able to communicate with the physician, not only just requesting appointments, but also having conversations about their healthcare, having actually a telemedicine opportunity to see the doctor virtually, to be able to care for very simple, straightforward clinical issues that they don't have to travel to their actual healthcare facility or the hospital or the clinic.
Patients were also feeling comfort because they were having continuous healthcare and they were not denied of any healthcare, because we were forced to close the clinic for a few days because of the pandemic and lockdown situation. In that situation, the eMedHub teleconsultation facility really helped both the patient and the doctor.
Nowadays, my entire family does online consulting on eMedHub, and this is like time saving and cost saving.
And of course, one of the most important things was transfer of information from one doctor to another doctor was very, very difficult. I have seen myself that I used to carry loads of paperwork, bringing them physically to one doctor while he reviews that, and then taking that and his notes to another doctor for review. This is a very cumbersome system and very inefficient, leads to duplication of efforts, as well as takes an enormous amount of time. I'm very proud to say that the company has employed all Indian and local talent to be able to help us through the development phase, the marketing phase, the business development phase, as well as ensuring that there's integrity and quality and confidentiality and all of these aspects that go into the development of a particular solid product, for us. So Ms. Shantakumari has been a remarkable partner in helping me achieve the improvement in the quality of the product that we bring into to the market.
வியாபாரமா இல்லை, சேவையாக தான் நான் நினைக்கிறேன்.
This is an extremely important aspect of what we do. We also have within our systems capabilities of providing reports to the doctors, to the patients, to manage their own healthcare needs as well. Now, this is extremely important because preventive care will essentially prevent patients from getting into complications from many of the serious illnesses that we see, in today's world. So that said, we are very happy with the response to the product. We are very happy with the amount of enrollment that we have with the patients and with the interactions we have with the doctors as well within the product.